Thank you for joining us. This is the NCCRT Policy Action Strategic Priority Team meeting. And this meeting really builds off of the meeting that we had in July, the Blue Star conversation we held in June, and just ongoing conversations we've had throughout the year. And we're really going to use this time today to really get geared up and ready for our in-person session at the NCCRT Annual Meeting. So I am excited to pass to our policy chair, Dr. Heather Dacus.
Hi, everyone. Great to see you. We can go right to the next slide. Yvonne is very kindly going to forward the slides for us today. But we want to just go around and give everybody a chance to say hello. We keep wanting to, know each other. Some of us do very well, but others not so much. So I'm Heather Dacus. I'm the director for the Bureau of Cancer Prevention and Control at the New York State Department of Health. In upstate New York, in Albany. I've been a member of the roundtable for a long time, a prior steering committee member. And as far as the last question here, yes, I will be attending the annual meeting. I'm going to do a brief overview of our team, get us all on page with that, talk about the key takeaways over the last year that have happened, which have been quite a few, including recapping our Blue Star conversation in June, and then really end with some potential project idea discussions, because what we want to do is really be ready to just dive right in when we get together in November. So today is really refining past ideas and identifying anything new that we should be talking about in more detail in November. So next slide. So it sounds like the majority of people on today either are or trying to, or they'll definitely going to read the notes when it's over because you're so engaged. The meeting in November and our policy strategic priority team meeting is that first day together, the Wednesday afternoon from 3:30 to 5. So if you haven't already been able to get on and register, please do. We look forward to it. Next slide. So I said who I am already, and just a quick other piece of background. I'm a preventive medicine physician by training, but have really devoted my 15 years of work so far with public health. Quite frankly, just there's so much to do in public health. So that's where I've been planting myself in upstate New York. But our policy team, our charge is to identify opportunities where the roundtable can educate on or engage in the day's emerging and pressing policy questions around colorectal screening. Next slide. And this is all part of the 80% in every community initiative that we're all very familiar with, and the 4 strategic focus areas: assess and build capacity in communities, catalyze healthcare systems, mobilize at public touch points, and break down policy barriers, which is where we come in along with others on the roundtable. Next slide. So the purpose of our teams, and we thought that this would be good to sort of revisit, because there's a few different strategic priority teams in the roundtable, but really what we exist to do is to promote dialogue on emerging topics, to come up with project ideas related to our specific priority area, help with identifying topics that can go and be part of the roundtable's new Blue Star conversations, which we did in June. Any of us individually can participate in advisory advisory committees for projects. So sometimes a project may get conceptualized and one or more of us may be asked to, contribute to the effort along with members from other groups on the roundtable. We can also definitely assist with dissemination of resources and relevant information. Many of us have a backyard and our own partners that really disseminating the resources we do and the roundtable produces is how we make these resources become actionable. And then finally, identifying other opportunities to promote the work of the National Roundtable. Next slide. This just puts into perspective, you've seen this before at prior annual meetings and elsewhere, those 4 focus areas, and then where the different strategic priority teams really lie. And you can see where ours lies in a pretty clear column, but the other strategic priority teams really cover these other main focus areas of the roundtable. And I think I would say, and we would all agree that our work covers a lot of those areas as well. So there's some overlap. Next slide. So aligning our priorities and breaking down policy barriers, really sometimes a lot of us live in the world of what we think of as big P policy, while others might live more in the little p policy world, and some do both. So I know for my own self at the state health department, I certainly get involved in big P policy. But then we also have local partners who are trying to promote policy change in their organizations or in their settings on the ground. So really making sure that as a team, we think about policy in both of these ways and try to identify where there are opportunities in either venue. Because we know that with effective policy, legislative and regulatory changes, we can really try to make colorectal cancer screening more affordable, accessible, and remove those barriers that we know exist. And then also we acknowledge that many stakeholders are needed to really make this stuff work. So that's why we all come together from our various different settings to try to have some traction on things that can really make a difference. Next slide. So last year when we met, and we had done that all virtually, right? This will be our first in-person meeting in a few years, which is so great. We identified the policies on the left-hand side and really had a conversation about what we could do. And from that, if you go to the next slide, after that conversation, we really honed in on working to better understand the different measure sets that exist for colorectal screening and how they intersect, and trying to come up with a resource that we and state partners and other partners could have to work on policy issues. So it was these two things that really stood out from our conversation last year: is understand the measure sets, and can we create a resource for states who want to work on colorectal cancer policy issues. And those of us that work with state level or regional level roundtables understand the potential value of some kind of a tool like that. Next slide. For that first one, the measure set, that really led to the ability to have a Blue Star conversation in June with Mary Barton from NCQA. It was a great conversation. I know many of you were there or saw the recording afterwards, but Mary from NCQA really was able to just clarify some things for all of us and highlight some of the upcoming things that we may be seeing on the HEDIS measures for colorectal cancer. So that was good. We were instrumental in convening that. Next slide. And then we met over the summer to sort of talk about what next, and really thinking about what we need to do, which that comes on the next slide actually, but don't go there yet. I'll just share here that this slide really shows what we want to try to accomplish again in November: is dedicate time to building our team and getting reacquainted, go through what I'm just gone over with and anything from this conversation, briefly, but spend the majority of our time in November discussing the activities in more detail and what we can do to focus in on for 2023 and come up with a plan. Caitlin and I do think that it would be worthwhile to have some more routine meetings of our group scheduled for the year. So we're talking about ways that we can set up something more standard with all of you. So it's not a last minute attempt to, get our availability together. Okay, so finally, and this is where I think this next slide, which is the last slide of this slide deck, is what did we talk about that we could continue to tackle or flesh out further? So one thing was produce a landscape analysis or publish a short policy brief on recent policy changes, because there have been a number of them, especially around the cost sharing and copay issue. So could we just capture all of that in something brief that's usable and actionable by partners. Develop a task list for states. So this idea really stems from every state, tribe, territory has a comprehensive cancer control program who are charged by CDC to implement policy systems and environmental change. So are there things we could gather from the various state partners, Comp Cancer, to find out, what are the high priority tasks for them? That was one idea. The third idea was to pull together case examples from state level groups to highlight successes and learn where challenges remain. A little overlap from the second one there. And then the fourth is create a plan to understand Medicaid incentives. That idea came out certainly in a few different conversations we've all had. And then finally, what can we learn from the other strategic priority teams or even the roundtable steering committee? Do any of those groups have particular policy areas that they can't tackle because they have other things on their plates, but they'd like us to be thinking about? So Caitlin, I went through that a little fast. If people don't have anything else for now, I don't know, Caitlin, we could wrap it up. What do you think?
Yeah, I think that sounds great. And, just to reiterate, hopefully you all have received your registration link for the annual meeting. If you haven't, please reach out to me and let me know, and we can make sure to get that to you. But really looking forward to seeing most of you in November.
Yes, indeed. And thanks to Yvonne for helping behind the scenes for us.